State health officials in Richmond said late this afternoon that they have confirmed yet another case of Legionnaires' disease. That brings to 7 now the number of workers at the Richmond Social Security building who have contracted the disease, including one worker who died. Today, the building on Nevin Avenue remained closed as a massive cleanup effort continued, and as most of the building's workers gathered for a special meeting. Vern Hawkins reports.
About 1,000 workers now on administrative leave were in Richmond Auditorium this morning. This was the first time Social Security and health officials had talked directly to employees.
Our investigations have concentrated on the air handling systems in the basement and looking for places where there's the chance for water for people to breathe in mist from water that may be contaminated with the Legionnaires bacterium.
A panel of officials fielded questions from employees.
There are a number of women in the building who are pregnant and who are nursing mothers, and I'd like to know what effect exposure to Legionella could have on the babies.
Dr. Rutherford said the babies are in no danger. At the building, just a few blocks away from today's briefing, more than 100 people are involved in the cleanup. Ventilating system cooling towers in the building have been identified as reservoirs for the Legionella bacteria.
We're cleaning the cooling tower as the most likely source of the bacteria. Unlike many other buildings, the cooling towers in this building are in the basement. The relationship between the cooling tower and the return air system is something that we're also looking at. We're going to be looking at making a temporary fix so that we are going through the building to treat any possible standing water source.
Kaiser Hospital set up a blood test clinic at the auditorium. Doctors say results for hundreds of workers should be in by Saturday.
I got sick before and I be having headaches now when I go to work. People are always in and out. They have viruses. We have a lot of sinus problems, a lot of sleeping disorders, a lot of things.
That's why you want
to
check out.
Right. So I want to make sure I'm okay.
Doctors call the blood screening retro tests. It won't show if someone has the disease right now.
Someone who's been sick a week ago, 3 weeks ago, and wondering now if that illness was Legionella.
The 6-story building has been closed since last Thursday, the day it was learned that a janitor who died of a heart attack while being treated for pneumonia had Legionnaires' disease. The bacteria were discovered in a basement cooling tower the next day. State health officials say the basement's cool temperatures, damp air, and limited circulation creates a growing environment for the bacteria. Most workers left today's briefing saying they felt reassured.
They've assured us that we're not going to go back to a building that's not safe. It's going to be very safe.
As long as the building is cleaned up, I pretty much will go back to work.
Officials said there will be another meeting like this one before work resumes in the building, that they're not sure when that will be, but it won't be this week. In Richmond, Vern Hawkins for the 10 o'clock news.
That outbreak of Legionnaires' disease in that Richmond office building is an extreme example of what many health professionals have feared for many years. Many of our modern office buildings can be breeding grounds for a multitude of medical problems. Business editor Brian Van Miller is here now with that aspect of the story. Brian?
Thank you, Dennis. Medical experts and office managers alike say this latest incident is just the tip of the iceberg when it comes to getting sick at the office. Because ever since the last energy crisis, more and more employees are working inside buildings that are so energy efficient, you can't open a window in the place. Well, that's good for energy savings, but may not be so good for your health.
Looking for scale and line.
Yeah. The cleanup continues at the Richmond Social Security office building, the latest victim of what is now called the sick building phenomenon. Experts think mist from these water cooling towers may have blown over to ground-level air intake systems, taking the bacteria into the basement. That kind of scientific detective work is in increasing demand.
The issue of sick building syndrome and building-associated illness is a very important issue and may indeed be the most important issue in the 1990s in terms of air quality.
Since this Legionnaires outbreak was first reported, Dr. Howard has seen a dramatic increase in calls to his state occupational safety and health offices from workers worried their buildings may be sick. Howard says while outdoor pollution was the issue of the 80s, indoor air quality will be the big pollution problem of the 90s, thanks to closed-up buildings with little or no ventilation.
So we're trapping a lot of air pollutants that are probably coming from things like tobacco smoke, chemicals exuding from surfaces of the furniture, formaldehyde for instance, particulates floating in the air, and biological hazards that come from standing water in our cooling towers or ventilation ducts.
David Bierman is no doctor, but he routinely makes house calls to sick buildings. He's part of a growing breed of environmental specialists called in by concerned office managers after workers complain of sore eyes, sore throats. When is it just a routine cold, and when is it the result of a sick building?
If it's one person, then, then you maybe can write it off. But when you start to have consistently more than a number of people, more than, say, 20% of your workforce out, or complaining of muddled thinking or fatigue at the end of the day, you've got to take a look at this as an issue because it's cutting into the worker productivity.
Bierman's medical kit contains items to diagnose excessive hydrocarbons from building materials. This machine reads excessive emissions of radiation from computer terminals. And this Anderson sampler catches air and sends it to this Petri dish to detect levels of bacteria in mold. What's the biggest problems he's found in buildings?
Consistently, the problem tends to be the heating, ventilation, air conditioning system. It's not bringing enough fresh air because of the office design. They're so tight now. And then sometimes it can also be, factors like the total level of volatile organic chemicals, new carpets, new remodel. That can create a problem, too, for a period of time.
Furniture.
Furniture, yeah.
And the list of problems Bierman and others say you should look out for in an office doesn't end with the air you breathe. You could be exposed to excessive noise pollution and poor lighting. Now, any story such as the Legionnaires Disease outbreak generates a certain amount of fear. But the experts say if your building is properly ventilated, chances are you're okay. And if you're in doubt, complain to management. With today's technology, most problems can be easily diagnosed and quickly fixed.
Except apparently in the case of Legionnaires' disease.
Legionnaires' disease is harder to detect, but with preventive maintenance, it can be eliminated. And also, if more people are feeling like they're sick and you get the warning signs, as could have happened here, that people are not feeling well, that could be one of the ingredients. It's harder to detect, but if you have the warning signs out there, it can be included in any diagnosis of a building. So it can be prevented that way.
Thank you, Brian.
Thank you.